Good afternoon, doctors. My name is Lissette and my topic is loop of Henle.
A looped structure called the loop of Henle, which reabsorbs water and ions from the urine and plays a role in controlling the concentration of urine.
What is loop of Henle? It's the portion of the anephron that leads from the proximal convoluted tubule to the distal convoluted tubule. The function we have that it creates a concentration gradient in the medulla of the kidney by means of countercurrent multiplier system, which uses electrode pumps. The loop of Henle creates an area of high urine concentration deep in the medulla near the collecting duct. This process reabsorbs water and creates a concentrated urine for excretion. In the parts of loop of Henle, we have the thin descending limb that has a low permeability to ions and urea, while being highly permeable to water. The thin ascending limb, it is impermeable to water and it is permeable to ions. The thick ascending limb, we have the sodium, potassium, and chlorine ions are reabsorbed from the urine by secondary active transport by a sodium, potassium, and chlorine co-transporter. The cortical thick ascending limb, it drains urine into the distal convoluted tubule.
The thick ascending limb actively transports sodium ions from the tubule fluid and moves it into the surrounding tissue fluid. Chloride ions follow passively. The thick ascending limb is not permeable to water, so the descending limb, in contrast, is permeable to water, but not very permeable to sodium and chloride ions. The thin ascending limb is not permeable to water. It is, however, permeable to sodium and chloride ions.
However, it'll be used for chronic heart failure patients. If you hear chronic heart failure patients and they have high blood pressure, you're going to be thinking furosemide. You're going to be thinking loop diuretic. Also, if the patient has edema, thinking they have that hypertension, that's why you use diuretics if they have edema and hypertension. But also,
in application in medicine, we have the diuretics that act on the ascending loop of Henle in the kidney. They are primarily used in medicine to treat hypertension, edema, often due to congestive heart failure or renal insufficiency. In advantage, we have that are more effective in impaired kidney function, and in disadvantage, we have that they can cause hyponatremia, hypokalemia, hypomagnesemia, dyslipidemia, rash, and toxicity. In issue applied in Ecuador, we have the loop diuretics that can treat edema associated with heart failure, hepatic cirrhosis, renal impairment, nephrotic syndrome, and hypertension.